So I think we're
Thanks.
about ready to kick off, probably. So it's my pleasure to introduce Professor Steen Halling, who's a licensed psychologist and Professor Emeritus of Psychology at Seattle University, where he has taught in the MA program in existential phenomenological psychology, as well as in the undergraduate program since 1976. Originally from Denmark, he received his BA from York University, Toronto, Canada, and his MA and PhD in psychology from Duquesne University in Pittsburgh, USA. His research and publications are focused on topics such as psychology of forgiveness, phenomenological study of psychopathology, psychology of hopelessness, envy, interpersonal relations, and qualitative research methods. He was editor of the International Human Science Research Conference newsletter from 1988 to 2017, co-editor with Ronald S. Valley of Existential Phenomenological Perspectives in Psychology, which is written in 1989, and author of Intimacy, Transcendence, and Psychology, 2008. And today we'll be speaking for just under half an hour on reflections on the tensions between openness and method in experientially orientated research and psychotherapy. Thank you very much.
Thank you, John. And it's good to be here. I sort of dreaded the prospect of being at a Zoom conference all night, but it's been really engaging. I mean, the last time I did an all-nighter was when I was in my 30s and was still in graduate school. But it's been really engaging and interesting. And although I think I'm going to probably fade within the next 40 minutes or so, I think I have enough energy left to keep going. A couple of days ago, I read accreditation, draft accreditation standards put out by the American Psychological Association. We'd be focused on graduate students in psychology and interns and postdoc positions. And they mentioned, of course, evidence-based practice, a great deal of emphasis on it. And I find that, as you do, of concern. The American Psychological Association is a gigantic organization. I mean, the joke is that when they have their annual convention, back in the days when people actually met, in a big city, the citizens of that city would flee in terror to the countryside because there's so many psychologists invading. It is an organization with a lot of power. I want to say just a little bit about my own perspective as a phenomenologist, a word which has obviously different meanings to different people. One of the simplest things I can say about how I think of it is to just mention the title of a paper I gave a couple of years ago. And the paper is entitled "The Phenomenon as Muse." In other words, that in my view and out of our experience at Seattle University, phenomenology means being led by the phenomenon, more so than particular theories or thinkers. A related phrase, which is the title of an annual conference we have at Seattle University, it's entitled "Giving Voice to Experience." And I want to add that in contrast to Manu, I have a great deal of respect for the work of Eugene Gendlin. One of the most helpful and creative articles that he ever published, and all his articles are available for free online, is about the use of theory in practice. And it's simply an excellent articulation of how theory can get you someplace but not further, and then you have to sort of open up to exploration and so forth. It's a wonderful, wonderful article. So the giving voice to experience has at least some affinity with the work of Eugene Gendlin. I also, I suppose, in some sense aligned with Merleau-Ponty, influenced by Levinas, and also Gabriel Marcel, who's not been mentioned here. One of the most wonderful things that Gabriel Marcel, he said it very briefly, but also elaborated on it, all his work, is that the we, W-E, the we is prior to the I. And that's both a philosophical, but also I think a psychological affirmation that's important to keep in mind in this day of individualism. I worked with our graduate students in a program which is existential, phenomenologically oriented, and prepares people for clinical work. And there we draw also on not only phenomenology, but also what you might call contemporary psychoanalysis, would include people like Kohut, actually Donna Orange, Atwood, and Stolaroff. So that's sort of where we are. And also was one of the founders of a continuing small nonprofit that provides low-cost therapy to people in the community that's not time limited and is not restrained by outside sources and insurance companies. Okay. I'm familiar with the research methods that have been talked about here, the heuristic, Georgie's phenomenological method, descriptive phenomenological method, as well as, of course, IPA. And I know Georgie's method quite well. I took about 4 classes with him when I was at Duquesne, and have also taught his method at the graduate undergraduate level. Ironically, it's not a method I use myself, except a few years ago, I worked with a group of 5 others, researchers, and we did a study of the experience of envy among executives. And we used a combination of Georgie's method and a collaborative method that we developed at Seattle University, which we call dialogal phenomenology. And the core of that approach is that you sit down together, you talk about your experience of the phenomenon you're going to investigate, get a sense of that, and start to reflect on your preconceptions, and then you go out and collect interview data. And then you do the analysis together in a form of ongoing focus on the descriptions you have and conversation with each other. And there's a very real sense in which the phenomenon becomes present in the room. Our first use of that approach was for the study of Forgiving Another back in the mid-'80s. And I think it's fair to say we did not come up with the method. The method sort of found us, or we discovered the method in the process of looking at the whole business of forgiveness. So it took us several years to understand exactly what happened. It was a lot easier to see, I found, what it was all about. It's not as mysterious as it might sound, but I taught a course at Duquesne University one summer, and the students got involved in doing dialogal research. And watching them work, and they stepped into it fairly easily, I could see some of the basic patterns that were involved in it, and finally had the words to talk about it or write about it. So that's an approach that's very much involving. Aside from that, I am, I suppose, somewhat ecumenical, more so than many people, in the sense that I believe that you can derive value from a number of approaches. Doesn't mean I don't have reservations. I'm rather, some others are rather leery of Heidegger, but put that aside. I'll just comment briefly on the presentations in not necessarily in order in which they're given. I thought Trikova's presentation was both courageous, and I think it's entirely appropriate to include one's own experience in the research report or doctoral dissertation. I really believe that the more deeply you go into your own experience, the more you're able to articulate something that is of broad interest and relevance. And as I listened to Jana's description of being in the room with the client and then subsequently writing this letter that she didn't send. I thought it spoke very well to something that's not just in relationship to clients who have sexual abuse, but other situations where one might find oneself at a distance as well as put at a distance, and then subsequently realizing that there is a depth of maybe unresolved issues or whatever you want to call it that can subsequently be looked at. You know, at the time one could not, but subsequently one can. So I think that's a theme that's of great importance. I wish she'd said a little bit more about the people that she also interviewed, but obviously there's also limitations of space. Some of the points that came up in that study, in one level, it's sort of common sense that you to work through your own issues as you work with clients. But another level, I think that's a practice that's more theoretically supported than actually worked out in practice. And so I think, again, that reemphasizing the value of that and connecting in the concrete clinical experiential situations brings that to life in a way that a textbook saying it would not. Elizabeth's study of her own experience of diagnosis of schizophrenia and the trauma that was involved in that, I think is similarly profound and, again, I think helpful beyond the particular domain in which she is studying. The revisiting of the experience when it almost became essential to do so, the shame that's encountered. In a sense, in writing about these experiences, she's joining a small but a really justly honored tradition of people who have written about their own experiences of sometimes severe disturbance. Anton Boysen's books, Out of the Depths. He was a pastoral counselor who was hospitalized a number of times and who worked with patients as well. Very, very powerful material, which I read as an undergraduate when I worked in a psychiatric hospital. It was very helpful. And my colleague, late colleague, Patrick Howell's book, Reducing the Storm to a Whisper. And he was a Jesuit who worked at hospitals and was also hospitalized several times. And the power of someone speaking about that experience and bringing it into the everyday, it's as if the everyday world expands in the process. You know, that which is not spoken about becomes spoken about in kind of an ordinary way. And I think that's the value for all of us, not just the person who goes through the experience, nor just for mental health professionals. I appreciated that there's a lot of tension within the academy in terms of putting emphasis on other people's experience as opposed to your own. And I think it's very important to have the quote permission to give that attention to your own experience. But I don't think that therefore would get in the way of also looking at other people's experience, even if they be quite different. In other words, I don't think one has to do one or the other, give emphasis to one versus the other. There are multiple valid accounts of experience that can broaden our understanding. One of the thoughts I had as she spoke about her research and including her own account at the end and saying, you know, maybe it's my way of resolving difficulties that I needed to get to. No doubt that's true, and I can't speak to that, but it also seems to me that the project itself called for that. So it may have been personal in one sense, in another sense, it's more than personal. I would argue, I think the study without the full account like that would not have been the same study, obviously, but also would not have the same value and power. Okay. I think I'm probably taking up more time than I intended to. I really appreciate O'Neill Brooks' presentation on the sort of imperialist aspect of traditions, including psychoanalytic one. And the case study, I thought, again, I'm really appreciate particular examples. I thought the case study presentation made it all come together in a very powerful way. His presentation also made me think of a wonderful, at least in this country, a classic article called The Challenge of Facing the Unknown in Psychotherapy by Peter Launer. It was written in 1981. And he writes, quote, "As therapists, we often move in darkness in which nothing can be seen." So this is a difficult, a vulnerable place. And of course, that's not where you are all the time. If you're there all the time, you might be in the wrong business. But there are those moments and those significant, maybe even weeks, where you're in the unknown. And learning to tolerate that is so important. And it's not something you can just teach theoretically. It comes out of practice. Excuse me. Well, humor is a funny topic, and I notice that it's in England it's misspelled, but you know that cannot be helped. There was a phenomenologist who, he's still alive, by name of Howard Polio. That was a joke, by the way, but who wrote about the phenomenology of humor. University of Tennessee, and that topic has been explored by several people sort of outside of the clinical realm. And I think it's a really important topic for multiple reasons, not just for therapeutic reasons. You may remember, if you read The Name of the Rose by Umberto Eco, the novel, that the sinister guy that he eventually got hold of was somebody without humor. So I think there's something dangerous about the absence of humor. And while it can easily be misused, as you know, the presentation pointed out, it is often a spontaneous occurrence that brings a movement forward in the relationship between therapist and client. And actually, and I'm not sure whether this is actually what was in what Patricia did, but I think having people give descriptions, no, actually, I think she did, although she didn't talk about it a lot, have people give descriptions of experiences they've had of using humor. And she did actually do that, and looking at them carefully, and you can sort of sort them into categories, but not necessarily the categories that the literature would suggest. There's a kind of self-forgetting in humor that I think is particularly valuable in therapy, because often both therapist and client are all too self-preoccupied or self-conscious. So humor can break that up and bring about one of those creative moments that several people talked about. Now, one of my overall, I don't know if it's a complaint exactly, is that, but those studies that used the Georgia method either didn't describe very clearly what they did, or used some rather odd version of it, which made it a little hard to evaluate, for them to evaluate how well the method works. So I wish that people said more about it, or would follow it more directly. I mean, that's the best way to test out a method, is to follow as it's laid out. And then you're in better position to speak about it later and say what its limitations are, or what may be its strengths. And I'll say a little bit later about, if I have time, how one can use that method more creatively than sometimes people realize. So the presentation on language, I think, is really quite wonderful and powerful. And since I don't have much time, I'll just very briefly comment on an example of setting up a situation where language becomes creative. Kathleen Norris, who's an author in the United States, has written about her experience working with children as an art therapist. And she got a bunch of young children to sit in the classroom, first made as much noise as they can, and then she had them be quiet for about 20 minutes, and then asked them to write about their experience of the quiet. And these 7, 8-year-old kids, or 5 or 6-year-old kids, had wonderful things to say about silence, very poetic, very powerful. It was a new experience for them. When they wrote about noise, they were used to a lot of cliches. So this is just a comment I wrote in relationship to that chapter and its value for psychology and phenomenology. Approaching experiences from a new perspective, seeing them as if for the first time, leads us to poetic, innovative use of language. This may be a risky path to take, but it's a risk that can be avoided only at a considerable cost. So there's a cost in not taking that path. We risk sounding overly subjective or unscientific, but the alternative is to rely too much on lifeless abstraction and the cliches of our disciplines. So I'm very sympathetic to the argument being made in that presentation, but I think that it's not true that method necessarily leads to deadness or leads us towards positivism.
5 minutes.
For several reasons. One is that I've observed with students when they used a method, a structured method to approach a description, it brought about a loosening or shifting in their perspective of what they were looking at. So any kind of method that leads you to look more deeply or differently at something than before, I think is the value. In addition to that, how you take up the method is not determined by the method itself. I read I don't know how many Georgia-based dissertations and a fair number of studies in IPA, then they very significantly, part of the differences have to do with how creative people are in use of language. There are different ways of writing about structure, essential structure, that are maybe very abstract, other ways that are much more lively and evocative. So if you think of the method as a step along the way and not a determining everything else you do, I think it can be powerful, useful. Now, let me skip lastly to Tony McSherry's presentation. Again, I think the topic was great. The nurses' behavior that was therapeutic, that Tony noticed was therapeutic, and exploring their experience. Now, again, I wish I would have heard a little bit more about what the method actually was, that it was a little abbreviated. And I suggested that I'm not suggesting that Tony should have done anything other than what he did, but I think it's a mistake to think that methods in research, they don't work if you follow them blindly. In other words, it takes a lot of creativity and imagination within Georgie's method, which surprises people when they come to it.
3 minutes.
I'm sorry, how many?
Just 3 minutes till questions.
3 minutes, okay. So I'll just say that. Okay. And so let me just, rather than trying to scramble and get everything together, let me say that sort of end there. Although I'm not so, I also would say that I believe we could come to conclusions. They're not eternal, they're not absolutely true, but in some sense that are reliable, that are give us important insights to experience. So while we may be getting it wrong all of the time, I think, in fact, we might well get it wrong, but also recognize that truths we arrive at, however systematically and carefully, are subject to revision, and even in some cases subject to being overthrown. So I'm not quite as convinced that we are sort of perpetually this is my metaphor. I'm sure Tony would use it, perpetually in the fog. Okay, well, let me stop there. Since I'm already losing my voice, I don't have much choice anyway.
Thank you very much, Professor Halling. I'm sure that will have evoked many questions from your reflections. And perhaps there'll be some further reflections from members of the conference. Do we have any questions?
I was just saying, perhaps I could kick off. Is that okay? I suppose what I'd kind of like to respond to is this whole issue about Georgie and method, if I could. I think that we might kind of have some kind of fundamental disagreement, but I'm not sure. I'm not sure.
Okay.
Okay.
Sure.
I mean, I think I'm not saying that something useful can't come from Georgie's method. Okay,
Mm-hmm.
I think it can, but I'm trying to sort of suggest in both my talk and my paper that it misses things, and it misses very important things, and I think there's a contradiction in the idea that we need to be led by the phenomenon. Which through Merleau-Ponty, the idea is that the phenomenon it's not just about the what, but the how. And the phenomenon will tell us. In a way, if you want to put it this way, the phenomenon will take us to the method. And I would add our bodies as well. And so in my doctoral research, which is some years ago that Sally mentioned, where I was looking at the unknown, I used Georgie's method in quite a lot of depth. And then I actually tried to do a different kind of analysis where I thought this is what I was doing, but where I thought I was trying to allow the phenomenon to guide me. And it was very interesting that when I just read the interviews, looked at my notes, reflected, things were revealed to me that had not been revealed to me when I used Georgie's approach. And it's difficult because that might have just been me. It might have been that my learning was developing and growing. I sort of thought that was the case, but I also thought the method got in the way in some ways. And so there's always this thing about what any method will reveal and what it will conceal. And trying to decide where the payoff is, where you have to do things. But I thought most importantly, what the Georgie method for me concealed was something of what was not what we were talking about particularly in the interviews, but what was going on between myself and the people I was interviewing. In terms of things like power and pet theories and those kind of things, which in themselves revealed something about the unknown. And that led to a very different account to the one I gave through the categorization of people's experience.
Well, I think I actually agree with you. If you take Georgie's method, I suppose too much like the way he would do it, it does not really include your relationship to the person explicitly, although it's there implicitly.
Yeah.
So I think I would also agree with you that the method doesn't exist by itself, it's how you take it up in some way.
Cool.
And I'm not making the argument that it doesn't have certain strictures to it, but I'm making the argument that it maybe has more possibility than people give it credit for. Now, if I thought it was the best thing since sliced bread, I would use it. And it's not what I have ended up doing, but I think it is powerful. And in our envy study, we had the dialogue about what we were finding. We did everything. We did either in pairs as a group, and then after writing the analysis of what's the general structure of envy, we had a pretty long elaboration of what that meant. So it also goes to the question of the value of having groups work together, because you may not have the words for something. I mean, as you write about. And then some situation comes along and helps us. Somebody else says, well, is it like this? And I think this is where Gentlin's approach is useful. Is it like this? You say, well, sort of, not exactly. You go back to the description, you can talk more. So it's a kind of creativity of fluidity that focused fluidity, focused on the phenomenon, can arise when you're working as a group. Whether you use the Georgia method, as we did for that study and not for others, or some other approach. So I would say, I would just put a pitch in for the value of working together in a group to articulate, to draw upon your own embodied experience. And it's a little more explicit, maybe a little more easy to identify there, because I might see your reaction to something that we are looking at that you might not even be quite aware of. And I say, well, so what was that about? You look sort of puzzled when so-and-so said such and such. So what was that about? So it's a way of bringing the embodied into research. And you also overcome the separation of the personal and the professional, because you bring in your own experience at the beginning, and that's because you, not because it's about you, but because it gives you a link to the phenomenon. So it's the way of inviting the phenomenon into the group. Anyway, that's a little tangential to what you said, but I understand what you're saying. Sure, yeah.
Perhaps we have time for just one more burning question, if there is one, before the next break.
Can I say something? Yeah.
Sure, Tony.
I really like that expression, the phenomenon as muse. You know, it kind of draws you into it, doesn't it?
Yeah. And it also traumatizes you sometimes.
Yeah, I think sometimes clients are like that. They're kind of like a muse, you know.
Yeah.
They kind of, I don't know, it's some strange relationship. But yeah, just about Georgie, I don't know much about Georgie really, even though I did do the PhD research using Georgie's method. I read lots of papers and books and stuff, but I always got a sense I didn't really know a lot. But he says something about, in the final kind of writing down of the outcomes, that there's a creative process. Mm-hmm. And he never really explored what that process was. And I suppose that's a problem for me, you know, that he didn't really go into the details of it. And one of the things I found difficult is that we have to describe the phenomenon in the language of whatever field we're kind of exploring. So say in the language of psychology, and that in itself is like a trap, you know.
Well, not quite. That's not exactly what he says. And I think he says that you may use some psychological expression, but he wants you to have issues like identity, but he wants you to use everyday language as much as possible. Yeah. He doesn't want you to step into a theoretical language.
Right. Yeah. And I suppose that's important, I suppose, isn't it? That, you know, because language takes us everywhere, doesn't it? So
it does. And I think the other thing too is that you know, we modify approaches that we pick up. In other words, I think it's important not to take a particular method too literally, or not feel free to, in some sense, transform it.
Yeah.
In the process of using it.
Yeah.
As long as you understand what the original purpose was, and have some sense that your transformation is improvement, rather than falling off the wagon.
Yeah.
Well, shall we perhaps finish right there? Thank you very much again, Professor Steen Halling.